Welcome everyone, and thank you for coming to our 6th webinar in our series. Today we are going to dive into using Spidertech after deep tissue massage and how we can use our kinesiology tape to further enhance what our goals are with massage, and then also help with our recovery following that massage to allow your clients and patients to get back on their feet as fast as possible and allow the recovery process to be enhanced. Excellent. So if we dive right in, as always, we will start with our mission, and our mission really is to help elevate your client's recovery by offering you the best quality product, by arming you as the professional with a streamlined approach to kinesiology tape, the highest quality kinesiology tape product available on the market. This is me. This is I. So the significance of my background with soft tissue therapy and then using the kinesiology tape for the recovery portion really stems from my experience in tennis for the most part, but also a little bit in golf. And when you're on the road and you're working within the kind of the professional setting, a lot of times you're the only therapist that is present, and you're kind of doing it all. I'm a chiropractor by trade, but certainly have got my experience with using soft tissue therapy, and including a deep tissue therapy. And I would say that the thing that I've had the most experience with is trying to figure out how deep to go with requiring performance for the next day. So always being aware of how we can get the best result from the deep tissue and the huge advantages that offers your client, but also making sure that we don't have a negative effect the following day if performance is important. And you can imagine in tennis, professional tennis and golf, performance becomes very important. And that's where my use of kinesiology tape came in, because I was able to go a little deeper. I was able to get the benefits of going of doing a little more tissue therapy by helping the recovery process, so the following day was not hampered by the tissue trying to recover. Our webinar goals, we attempt every time to keep these nice and simple. We want to know how Spidertech can be beneficial for after deep tissue therapy. And then we're going to use our fan Pro Cut as our example today. And we'll go through a little more in depth as to which Pro Cut we would choose. The reason I like the fan so much following a soft tissue or deep tissue therapy is that it can go anywhere in the body. So this is kind of the universal one where wherever you decide you need to go to dig into, you can apply the fan on that area of the body right after. And our advantages of using kind of the kinesiology tape that is kind of the next level of kinesiology tape that is the highest quality product, which is our Pro Cuts, is we make them so they become standardized. They become very simple to apply. They become long lasting because you're not trying to use scissors. You're not fumbling around with that. You're not touching the corners as a result of kind of the meat machine cut edges, as a result of the harder backing paper where you don't have to get your fingers on the adhesive, all helping to increase the length of the wear. Becomes very reproducible, as you can imagine, being that every application is the same. And as a result, time is saved in the clinic, time is saved on the sidelines or wherever you are applying it, which takes us into our last, which is it can be applied anywhere you are helping your clients and your patients by using tape. And certainly that kind of also takes us into the fact that this can be worn during all sports. So it can be worn while they're at the office, while they're at the gym, which really separates our kinesiology tape from every other modality out there that does a similar thing. It can be worn in every setting. So I think to start our understanding of what we can do after deep therapy, we need to look at what kind of deep tissue therapy is trying to achieve. And so our goals, as I see them, of that type of deep tissue, or of that soft tissue therapy, is to reduce the tension within the muscle, reduce muscle soreness as well. We want to be able to improve the tissue relative shiftability, comparing to the tissues that kind of surround it, and that brings us into our fascial work as well. We're going to have an effect on the neuromusculoskeletal restrictions in that area. Everything we do is going to have an influence on that, which is what we're intending. And then as a result, we can reduce that pain threshold, we can reduce pain, and we can accelerate tissue regeneration. Certainly, again, it becomes pretty important after a hard workout, after your sport being tough, or even after just the muscles being tight and need to get back to normal. So with those goals in mind, where we think that our Spidertech tape comes in to help with those things, it becomes the first one where we're trying to reduce muscle tone, and we're going to look at some studies that kind of help prove every one of the 3 points. So we want to improve the muscle tone, that tension feeling or that soreness feeling. We're going to help restore normal proprioception. And the reason for this is after our tissue therapy, I think it becomes quite common that the temporary effect we have on the tissue, that we kind of lose a little bit of that proprioceptive control. I think that after going hard into the tissue, we're a little bit more vulnerable to the tissue being a little more relaxed and not having the precision of activation. And I know that a lot of times people kind of feel like they're relaxed, but they're kind of soft, and they don't have that core activation if we're getting into the low back, or we don't have the kind of that muscle activation that you've been working on as a result of just the temporary muscle work that's been done. And then lastly, we're going to look at how Spidertech can prevent fluid pooling, and this can be as a result of the micro trauma that can come from the tissue work that's being done, or it can be from the working on the muscle and kind of squeezing out all that lymph fluid, and so we get that collection of lymph in the area, and we're just trying to make sure we don't get any pooling, which has multiple benefits if we can get that tissue to leave the area, to allow the regeneration of that tissue, and to allow to prevent the soreness, prevent the puffiness, and kind of make sure you wake up the next day feeling as good as possible. So those are going to be our 3 goals today. If we dive right in, and our first bullet there was how we reduce muscle tone, muscle stiffness, and so we look at a study here, and this is a new one that we've addressed. This is a 2017 study out of Korea, and I think the important thing to recognize here is we're dealing with shoulder pain. We're dealing with people who are in the study that have shoulder pain, so these are people who are not at their best, and they're going to have muscle tension going in. So this isn't looking at the tension of a muscle at its best. This is looking at the tension of for instance, the supraspinatus when it's been sore and painful for quite some time. And so the 2 objective measures that they looked at was muscle tone and muscle stiffness. And so the tone just kind of being that feeling of tension through the muscle. It's kind of like that continuous feeling of contraction, and which is kind of where also the tone is what we need to maintain the normal posture, but also an increased tone is felt as well. And then that muscle stiffness, which is more kind of the pain and the tightness feeling, it would be the second objective measure that we're going to take a peek at today. And so if we dive right in. We looked at evaluation after 1 day, 3 day, and 1 week of combining heat and electrotherapy That is done with both groups, and then the experimental group had to tape as well. So in our control, you can see in the bottom there, we did heat for 10 minutes every day. We did electrical stimulation for 20 minutes every day, and we can see that alone was able to reduce the muscle tone, as you would expect. Certainly the stim would be something commonly you would do to kind of decrease tone, and as a result, you did. We got after the first day of using heat and stim, we had almost a 10% improvement. After 3 days and a week, we saw a continuous improvement of 16%, which is great. When we add in tape, and I think the interesting thing about when we added in tape in this situation is they took the tape off before they did the evaluation. So they did the heat, they did the stimulation with both groups. They applied tape after they did that to each one of to our second group here, but they removed it before doing the evaluation of the muscle tone. And so even though the tape wasn't on, we still saw much better numbers. We saw a 25% after 1 day improvement, a 34% improvement after the 3 days, and then after 1 week, again that 44% improvement was seen, even when the tape was taken off. They had the same order of evaluation with our muscle stiffness, with kind of looking at more of our pain and our feeling of tension, and that we saw that within the group of just heat and electrical stim, we saw 7, 8, and 10% improvements in that feeling of stiffness, where we get a bigger improvement of 8, 12, and 16% improvement by adding in the tape in the times between the heat and the stim that was done. So I think this is the reason I kind of like this study is we take a look at how we would do it in our clinic, where we would do our therapy. In this case, it is stim and heat. You can also do soft tissue. You can also do your adjusting, your moves, your exercise therapy, and then the tape is the last thing we do, kind of the finishing thing we do to bridge the gap between our next treatments. I would be interested to see what numbers we would get if they left the tape on during the evaluation. Certainly, there's other studies out there where they look at low back, erector, for instance, erector stiffness, and we do get kind of bigger numbers if you keep the tape on during the evaluation, where kind of like after a week we're looking at kind of 16%. In other studies you'll see up to kind of like 40% improvement. But no matter, it does show the importance of adding tape into your therapy. And as you can imagine, our conclusion is quite straightforward in that is that you should include kinesiology tape within your treatment programs. All right, so that concludes our tone and our stiffness, how we can have an effect on the muscles. And so I think that's the one where we're continuing the work of the soft tissue therapy. That's the piece where we can continue the objective, which is kind of get these muscles to relax in kind of a broad way, the same way we were trying to do with the therapy. So keep that in mind. If you finish your soft tissue, you've done the deep tissue, and you feel like maybe there's still a little bit of tension through there, there's still a little bit of soreness through there, you can get that tape on and tape it in the same way that you feel with your hands. Wherever those tense muscles are, get the tape on that muscle, and that's kind of the continuation of the therapeutic approach to that one. The next two studies we'll look at is going to be helping with the recovery process. We're going to look at making sure that we maintain our proprioception after our deep tissue. So in this study, we look at the immediate effect of taping on our muscle strength, our balance, and our proprioception. And so in this case, they used eccentric muscle fatigue to essentially cause micro trauma to the muscles. I guess we can kind of liken this to soft tissue trauma to the muscles. And certainly, if in the athletic standpoint, athletic realm, you would have the muscle damage due to the workout or to the athletic event. Then you do a deep tissue, and then you use the Spidertech to help recovery. So I think this all kind of is within the same realm, and I think we can kind of make correlations based on this. And this is a brand new study out of China in 2024. So the first thing we want to take a peek at was our proprioception. And now we're going to kind of focus on our no tape versus tape in this study. But you can see that they also looked at the NT being no tape, the ST being sham taping, and then the AT being athletic taping, where they use kind of like white medical tape. But for our numbers standpoint, we talk about we're going to go just from like the no tape versus the kinesiology tape. So in this study, they used a joint repositioning test to determine your ability to have a better proprioceptive awareness. So following the fatigue, what they looked at a shift in dorsiflexion and plantar flexion, and as you can see, there was a significantly less amount of repositioning error in the kinesiology taping group on both plantar flexion and dorsiflexion. So essentially, you're able to control your body a little more to kind of reproduce the positions that you've been started in, which I think has huge benefit for being able to control your body following the tissue therapy, where you might feel a little soft and jello-y and don't really have that contraction or that muscle awareness, just as a result of the work that is done from the tissue therapy. So as we saw in plantar flexion, following kind of just checking no tape to tape, we saw a 30% improvement in plantar flexion reproduction, or positioning reproduction, and then a 53% in dorsiflexion ability to reproduce our ankle into the position that we wanted to get to. If we look at the other things that they went over in the study, which was your balance and your ability to kind of regain strength, and this is again this is kind of separate from proprioception, but our balance is quite close, and the strength, regaining the strength, it is quite interesting, being that could be relevant for your practice as well. What we saw was in a stork stance and kind of like a one-legged stance with the eyes open and eyes closed, that by using tape compared to no tape, following the fatigue protocol, that we saw a 51% improvement in your ability to kind of keep your balance. And then when you, and my mistake, the 67% there is with eyes closed. So when you close the eyes, again, you're relying more on your proprioceptive awareness of the joint throughout the body. As we know, we kind of have our vision. We see the horizon, knowing where help us with our balance. We have the equilibrium in our inner ear to kind of know where our head is relative to the ground to help us with our balance. And then we have all the mechanoreceptors within our joints, in our skin, our muscles, tendons, ligaments, joints, throughout our entire body, that help us kind of understand our positions. So when we have the eyes closed, we take away our vision, which a lot of people rely heavily on, just based on the fact that we always have our eyes open and we're always scanning the horizon. So if we take away the vision, there's more emphasis put on the positioning of the head, as well as all those mechanoreceptors within our tissues that help with proprioceptive awareness. And so as we see with the tape on compared to no tape, we get a massive increase in ability to hold balance. And then lastly, we can kind of dig into we can dig into the graph, but I think what's important to see here is we have our peak torque, we have our average torque, and we have our ability to generate power. And with our black portion of each one of the graphs being our kinesiology tape, we see that in every test that they did there, the kinesiology tape group was able to generate more force, torque, power than our no tape. And then even with our, compared to our athletic taping, we see that we're able to restore or regain our strength compared to those other groups. And that's something, that you'll see over and over again in our in the literature, is when you're fatigued, and I think that's that's a very important thing about the study, is the fatigue protocol that was used. It is the fatigue protocol that was able to diminish the no tape group, that was able to diminish the athletic tape group enough that we saw the performance go down in proprioception, in balance, and in strength. The kinesiology tape, because it goes on the skin, it lifts up, it stimulates those mechanoreceptors within the skin. That is enough enough of additional information about the area the tape is to help your brain restore that, essentially getting you back to your normal ability to generate proprioception, strength, and balance. And so I think a great study, and if you were to design this over and over again, I think the most important thing here is that fatigue protocol, and if that's the case, we'll see these results being reproducible over and over and over again. And then as a result, the study showed that kinesiology tape significantly enhanced muscle strength and proprioception after our eccentric muscle fatigue on the ankle, more than our other taping methods, which we saw. Furthermore, the kinesiology tape surpasses athletic taping in improving static balance, static postural control, post-ankle fatigue. These insights can help guide healthy individuals in choosing the suitable taping technique to quickly recover from muscle strength, proprioception, and static balance affected by eccentric contraction-induced muscle fatigue, and lowering the risk of injury. So again, that last little bit there of avoiding the risk of injury, that's where it's a really important piece. The kinesiology tape helps you get back to your normal ability to control your body, your normal ability to have balance, your normal ability to have strength, so you can prevent injuries. A really common reason for injuries is fatigue, and we lose that connection with our body, and we're not quite as fast, and the tape can kind of get at that mechanism and help get you back to your normal state. So that's kind of the origin for a lot of the fall prevention protocols that we go through, and making sure that you're good at the end of your sport, just as you were at the beginning. So yes, we'll leave that with the significance in our soft tissue is if you're getting into the low back muscles, if you're getting into those erectors, the QL, and we got everything to relax, the tape's going to be on there to restore our normal ability to control our core muscles, to control those muscles that we just beat up, so the spine isn't vulnerable to extra motion, so we can kind of regain our normal core awareness, our normal core control. All right, and then our last study that we're going to look at here is that ability to flush out the fluid that is going to be created from the tissue. As I mentioned before, whether it's the microtrauma from working on the muscle, or if it is the lymphatic fluid in the area, or if you're working on a part of the body that is already sore and there might be some injury, which is why you want to kind of get in there as it is. We're going to look at how the tape can help flush out that area from the kind of the byproducts that we don't want. And certainly after an athletic event, kind of getting that flush, getting that tissue to be free of all that fluid becomes a very important piece in the recovery process, especially if our performance the next day matters. And what goes along with performance as well is just the feeling of, waking up not feeling sore, not feeling puffy, not feeling like you've been kind of beat up, and all of those things can be helped with applying tape over the area. So chose this study because it kind of helps understand the mechanism that the tape works. There's a number of studies out there that also look at how we can kind of get the fluid to flush out after fatigue protocols, after kind of DOMs, after hard workout. But I think this one I like for this occasion because it helps understand how it works and what we can expect. Also, you can understand the principles of how the tape is affecting the body, so then you can choose to apply it the way that your clients will benefit the most. So in this study, we have this is the mechanically induced pain, or like a bruise on lab rats, and so they're looking at after the induced trauma. We're going to look at what happens to the space underneath the skin, in the space kind of in between the skin and then the fascia, in that the dermal area. And then so what we expect to see is, because the trauma, the fluid, the bruising, the swelling is going to come from below, we expect to see with our tape group that that epidermal distance is maintained, where if we're dealing with no tape situation, we're going to see that area being squashed from below. And that's exactly what happened in our study here. So after the trauma happened to the thigh, in this case, we saw that in the leg that had tape on, we were able to have we saw a 34% increase in that interstitial space, that space between the epidermis and the dermis, as a result of the tape being on there, gripping on the skin, lifting it up, and kind of keeping that area pried open. After 6 hours, we saw a massive improvement, or massive increase in that space, because in the no tape side, we saw that the bruising, swelling, inflammation was pushing up and squashing our space there, where the tape group was able to maintain that space underneath the skin. And so as a result of that dermal space being maintained, we were able to see the continued flow out of blood, inflammation, swelling, and also our lymphatic fluid in the area. And so after a 6-hour mark, where in our no tape side we saw a huge amount of blood and lymphocyte infiltration in the tissue, in our tape side we saw no blood. Everything had flown out. There's no kind of stagnant lymphocytes, blood being kind of in the area where the trauma happened. We saw the distance where the trauma happened, like the swollen area it had spread out significantly in the side where we had our tape on, so allowed the fluid to start to move out of the area. Where in our side that didn't have tape, we saw that there was more of a focal area of swelling and fluid. And then as a result of that, we didn't see the nerve growth factor kind of in the area the same way we did with our no tape side. And it's the nerve growth factor that stimulates the nerves in that area to heighten and make you more sensitive to kind of that the pain sensation. And so we didn't see the level of kind of pain. We would expect that the level of pain in the area wouldn't have been the same because the nerve growth factor wasn't there to sensitize those nociceptors. And as well, we didn't see the immune system kind of infiltrating in there to tear the tissue down to build it back up, where we did in the no-tape side. So we were able to reduce the damage that our body naturally does after trauma happens, to kind of clean up the area and make sure that we can lay down new tissue. Where in the tape side, because the fluid was moved out, because there was no immune system kind of making sure that the area was cleaned up, because the fluid was able to move out of the area. We didn't have to tear down the tissues, like the collagen fibers and everything else in the area to build it back up. And so they also saw that the 3D integrity of the collagen fibers in the area was maintained. So the tissue's normal integrity was maintained, versus in our side where we didn't have the tape, where the collagen fibers were torn down in an attempt to build them back up. But in the attempt to build back up, that's where we can also get into issues with scar tissue production. And so if we can make sure that the integrity of the tissue is maintained, we can extrapolate that scar tissue production wouldn't be as much of a probability. So we can almost kind of reduce the scar tissue from occurring because we didn't have the same level of insult or same level of trauma, because everything kind of flowed out of the area as soon as the injury occurred. And the reason that this happened, as you can imagine, the tape goes on the skin, it lifts the skin, it elevates it, and that elevation pries open that space underneath the skin that we were speaking of, and so we can reproducibly open up those lymphatic vessels that are commonly found in that area. And the actual connection that we see within those lymphatic vessels is through the anchoring filaments, which are connected from the inner part of the lymphatic vessel, and they connect with the skin above, and also the tissue below. So when the tape is on there, that we can reproducibly elevate that skin and get that same level of lymphatic flow. And so if we go to the next slide there, we'll see, we can see here that our lymphatic vessel is there, and we know that the lymphatic fluid is going to continue to move out of the area because we don't see that squashing from the tissue below it as a result of the tape lifting up the skin, coming from the elasticity of the tape, which contracts back and elevates the skin to give us that prying open. And lastly, we mentioned pain a couple times, and there also is a significant benefit to the stimulation of those mechanoreceptors in the skin, and from a pain standpoint. Certainly, when we have our soft tissue therapy, where we're kind of getting in there sometimes fairly deep, and so that has negative consequences in terms of kind of the tissue being beat up a little bit. And so right after it happens, the constant mechanoreceptor stimulation, primarily the Merkel cells in this case, has a benefit for the patient leaving and feeling like there's less pain, and that kind of occurs also through all the mechanisms of decreasing the fluid in the area, but also from our sensory gating mechanism, where we were able to block or interrupt the information getting to the brain by stimulating those mechanoreceptors, which are bigger, stronger myelinated nerves, which take priority over our smaller C fibers for the most part, pain receptors that are going to carry that pain signal to our brain. And so with our sensory gating, we're able to have an effect on that pain signal before it even crosses over the spinal cord and ascends up to the brain, so that your clients feel better. There's less pain when they leave your treatment. But then also certainly when they wake up the next day, we spoke about there's not the pooling of fluid. We don't have the puffiness, but the tape's been on all night, and so now they're also working on. They also have to they kind of reap the benefits of the nervous system type pain not being as high, and we're not kind of feeling that blow just from the tissue insult from the soft tissue therapy. So we're going to take a peek at our fan ProCut, and as I mentioned earlier, I like this one because this can be applied anywhere on the body where you get deep into that soft tissue therapy. As you can see here, and we'll get into it. The fan are smaller strips. They certainly promote the flow of fluid, and so if you expect that you've got in there really deep and there's going to be a lot of fluid accumulation, lymphatic fluid, maybe even some swelling or bruising from previous injuries in the area that you're working on. If there's arthritic, or if there's fluid from maybe some arthritis in the area, so we kind of get some. There's already a little bit of puffiness or fluid before you get into the tissues around it. That's where I would say that the fan is fantastic. If you were going more for just kind of the nervous system stimulation, if they were going to the gym the next day, if they're playing a sport the next day, maybe that's where I would go with just your normal ProCut in the area. For instance, if you're doing tissue in the low back, maybe that's when we go with the low back ProCut afterwards. If we're going with, if you're getting into kind of the hip and then kind of the glute muscles, maybe that's where we go with the hip ProCut afterwards. Just so you understand and you can make those choices based on what your client's needs are. But I would say and more often than not, I'm going to use the fan ProCut just because it's a little more versatile wherever the soft tissue therapy you're doing is. So we'll dive in here, and with our fan ProCut. Great. Yeah. So we're going to put it on our calf in this situation, but again, this can be put on anywhere in the body. Great. And so the important thing here is that when we apply it, whatever part of the body you are, I want you to stretch the tissue as much as possible that you're applying to, and that's so we don't run into any issues where the tissue, the range of motion of that joint or the area you put on exceeds the 140% amount of stretch that the kinesiology tape has. And so we're going to stretch the tissue, our calf, for instance, here, by applying dorsiflexion to the ankle. And then with our fan, I'm going to attempt to use the first two strips first, and that's so I can go over the exact spot that we're going to apply to, and so we can get over the middle of the area where the tissue therapy has been done. I'm going to aim to leave the same distance between the strips that the strips are wide, and so if the strips are a centimeter wide, I'm going to leave that centimeter in between our strips, as you can see here. And then I'll apply the next two outer strips to the kind of the surrounding area of the spot where we've done our soft tissue therapy. So wherever you feel like there's going to be accumulation of fluid, where the lymphatic area is going to be affected, that's where we're going to apply the fan to. We also can overlap two fan ProCuts the way that it is in the picture here. Just keeping in mind that when we get the overlap, kind of that basket weave appearance, we reap the benefit of the fact that the tape over top of tape is going to provide a greater lift to the skin below it. So that is a significant benefit. The only thing to consider there is the tape doesn't apply as well to the other tape as it does to skin, and so where the spots where the tape is basket weaving or going over top of one another, that's the spots where we're going to have a little bit of a weak spot in the application. And so this one the basket weave may not last quite as long, but the ability for it to work and the impact it has might be a little bit greater. So keep that in mind when you make the choices to kind of use the fan basket weave or not using the basket weave. We're going to circle back here, and we're looking at how can we use Spidertech to help with our deep tissue therapy. We can use it to augment the tissue therapy by further reducing the tone of the muscle, to further reduce the stiffness of the muscle. And we saw that can be done with kind of the constant stimulation of the skin above it, and how that has a normalizing effect on the muscle through activating the nervous system. From a recovery standpoint, we see that how the Spidertech can help with increasing the proprioception after trauma, after the tissue's been worked. And so we ensure that your clients aren't vulnerable to injury, vulnerable to not having the same muscle activation after the therapy happens, and also how you can regain the strength and also the sense, our balance sense as well, was lumped into that same study. And then our last study showed us how we can, by elevating the skin, by prying, essentially opening up the lymphatic vessels, we can help flush the area of any pooling fluid that might be there as a result of the micro trauma from the therapy you do, or from the trauma that's already in the area that you're attempting to work on. And then under that same idea of lifting the skin, providing awareness and sensation to those mechanoreceptors, we saw that has a benefit on also the nervous system and how we can recognize and modulate pain, where we can decrease the perception of pain and how it's felt, as in addition to the benefits of decreasing the swelling in the area and how that affects pain. So we can kind of hit it from both angles, from the flushing out the fluid to modulating the pain reception within our body. And finishing up with our webinar goals, which is how we can benefit from Spidertech after our deep tissue therapy. And then we learned about the fan pro cut with our example. But as I mentioned, we can see the same benefits from using our other pro cuts in that same manner. Just making sure you get tape over top of either the tight areas, the areas that still have muscle tension, or on the areas that you want to promote recovery to for after your therapy or the next day. That concludes things, and let's jump into our Q&A. Right before we kind of finish with our piece about recognizing that in the clinic setting there really is a way for Spidertech to help every one of your clients, from improving posture, muscle tension, swelling, bruising, proprioception, as we saw today, injury rehab, and pain. As well as we saw with our studies where they use the tape as the treatment between treatments, as the addition to the normal physical therapy, which they had the heat and the electrical stim. I think that's exactly how you will use in practice. You do your normal therapy, you add tape in, and at the very end, and the benefit is continued through the time you're not seeing your clients. And then as a result of the innovation in our product being the high-end version of the kind of the outdated roll that so much of tape is today, that your application of Spidertech becomes a business card and becomes an indication of your high quality therapy that you provide to your clients, not going with the old outdated role and now stepping into the new innovation with our ProCuts. Okay, let's jump into our Q&A now. Excellent, thanks, Paul. I'm just kind of pulling up the chat here. Excellent. How long? Excellent question. So I would do it with the last. I would use the last thing I do before they leave the treatment room as a time to put on the tape. The thing to keep in mind is with any of the tissue work you're doing, you're going to need to make sure you're aware of if the cream, the oil, the gel you're using is oil-based. That's the one piece that's going to affect the adhesive of the tape. And so what I do in practice is I use a water-based gel. I don't use an oil-based cream or lotion, and that enables me to put tape on at any point. If you still want to use the oil-based cream or lotion, I would say you're going to need to either use a rubbing alcohol, you're going to need to use a hand sanitizer over the area that you want to apply the tape, clean it up before you apply the tape. So it's really important that you're aware of the area that you want to tape, and make sure the skin is oil-free, because that really is the one thing that is going to affect that adhesive. So just keep that in mind. But yeah, the last thing, I would get the tape on as soon as you're done, so you can get that skin elevated, and you can reap the benefit of there not being any pooling, congestion in the area that you've worked on. Okay. How long do you wear the tape for? Thanks, Ollie. I guess the answer to that one is get it on as soon as you're done the therapy, and have it on there for as long as it will last. I think depending on the skin, kind of the oils in the skin, depending on how kind of rough you are, how much range of motion there is in the joint, you certainly can expect 4, 5, 6 days of use after the therapeutic session. And so I would have them put it on for as long as it will last, and you can expect the benefit of also of the reduced pooling, as well as the mechanoreception stimulation and decreased pain through the entire time you're using it. So yeah, I would say just keep it on there for as long as it will last. Finished, Holly, the last question there, which is, how does tape help increase strength after exercise? And that kind of going back to our study that we looked at, I think it increases the strength by decreasing the normal detriment that would happen as a result of fatigue. And so there's certain studies that are done on people without the fatigue protocol on healthy individuals, and yeah, you might see a percentage too of increase in strength by using tape, 4, 5, 6%. But the way to see the big improvements, which we saw today, is after a fatigue protocol, after an injury, after there's been an insult to the tissue, where you're not comparing it to your healthiest state, you're comparing it to where you would be as a result of kind of not being at your best. So the strength improvements are actually just allowing you to regain your normal strength, getting you back to where you would be normally without the injury or the fatigue. And that's where we kind of reproducibly, reliably, over and over again, you'll see that, and that's where our fall prevention programs come in, is because now you're back to where you would be before you retired. Now you'd be back to where you were before your injury or your surgery or whatever it was that interrupted that proprioceptive awareness that you have in the area, that's interrupted that ability to generate force through the muscle. The tape and the constant stimulation through that area, through the muscle, enables you to kind of get back on your feet and regain your normal strength as fast as possible. Is the tape waterproof? Yes, certainly water resistant, and so it kind of the water is able to flow through it and out of it. It is a cotton fabric with just the elastic property to it, and so the water it doesn't have a negative effect. I would say things to be cautious of is because the adhesive is heat activated, you can wear it in the shower without problem, but be careful not to take it off in the shower because when we take a warm shower, the adhesive becomes activated. It actually becomes a little stickier when it's in the shower. So be aware of that. So feel free to bathe the shower with it on, and there should be no issues with water. If you're getting into hot tubs and things like that, because of the length of the hot tub and that you're activating the adhesive, that generally will decrease the length of wear. But as long as it's kind of just a shower, there's no issue with kind of getting out and the tape being still on there and still adhered the same way it was before the shower. Is there any studies on tape used with connective tissue disorders? So Megan, do you have any specific connective tissue disorders that you're speaking of? Certainly, if we're looking at some like a connective tissue disorder where we have like extra laxity in the tissue, then that's where yeah, exactly, like Ehlers-Danlos. There's a couple studies on that. There is significant improvement using the Spidertech tape. I also have in practice used it with a number of patients who have that laxity, that Ehlers-Danlos, and how I conceptualize it when I'm using it is I'm not trying to restrict range of motion by pinning things down, by constricting joints. I'm putting it on there in a couple ways. One is just to provide extra awareness, and so I'll put it on the knee. A lot of golfers I've worked with, for whatever reason, that's a sport that I've worked the most with this disorder, and so the knee will rotate. We'll see a lot of rotation, so we'll put tape on the knee to certainly help with the awareness, and so the brain can control the motions in a more effective way. We're just providing as much proprioceptive information to the brain as we can, so your brain can make smarter decisions and stay aware of the area. Also, have used it in cases where, like for instance, calves seem to get quite tight. So we'll get it on there to help decrease the tension and the tone of the muscle. If the kind of muscle tonicity becomes an issue, which like in the patients I've worked with, that seems to be the issue. So that's where I would go with it. I would try to aim for increased proprioception in areas where there's lots of motion, and then also decreasing like resting muscle tension in the areas where where it just feels like muscles are tight all the time. Thank you for the questions, everyone. Is there more out there based on what we've gone over today, or from previous webinars, or just experience that you have in the clinic using Spidertech? All right. Well. Continue to write if interested, but I will say thank you again for being here for our 6th webinar. We're going to tackle in our 7th webinar how we're going to dive deep into how our Spidertech tape has an influence on our balance proprioception and kind of get more into the science of that and how you can use it to, we've mentioned fall prevention programs today, how we can use it in multiple different ways to make sure that our clients are as primed athletically as possible, as safe, fall and injury prevention wise as possible, and how we can use tape to maximize those pieces. So thank you so much for today. That's been fun as always, and we look forward to seeing you in another month where we can dive into more great things that Spidertech can do for our clients and making their lives better. Thanks everyone.